morning, everyone. Welcome to Sun Up on 7. Thank you so much for being here with us. If you missed our first segment, let me just give you a quick recap of what you missed. We had Dr. Cervantes here, who's a neurologist, and he was talking about MS, basically giving us, what's the origin of MS, which is a disease that affects the layering of the central nervous system, which basically causes it to have different symptoms on individuals. So individuals might have different symptoms, but what the thing that sticks out is that it doesn't have a cure, however, it's treatable and the treatment is expensive. And over the last few days, we've been having conversations about local artist Marlene Vanson, who's currently sharing her journey with us on MS. And we're reaching out to you, our viewers, to find any way how you can support her. There's a barbecue happening at 29th at Battlefield Park. So please come out and support. And of course, on her Facebook page, you can find out details as to how other ways you can be of a support system to her. Now we're talking about COVID. So let me invite you to this next segment where we have Dr. Cecilio Eck, who is a pediatrician, and he is going to be talking about Omicron and its impact on children. Dr. Cecilio Eck, good morning. Thank you for joining us via Zoom here on Sun Up on 7. How are you doing?
Good morning. I'm doing well.
Dr. Cecilio, I got to say, it's good to have you here, not just the fact that you are having this conversation with us, but given your journey and your recovery to COVID, it's so thankful and so good to see you recovering well and being able to continue providing your quality service to our Belizean population. So thank you, and we are extremely happy to have you here with us.
I appreciate the invitation as well, and to give thanks to the Lord and to all the docs in Belize who participated in me being here, because with the journey I went through, most people that I know would have passed away. Yeah. So I give thanks every day for that, and live each day to the fullest.
Yes.
That's a very positive note to even start the conversation on, because when we think about schools and just thinking about children going back, a lot of parents are not really of the idea of living the life to the fullest or sending their children back in the first place, because there's that constant fear of, will my child contract COVID? And then if you're a very young child, you would think about the idea of there's not the vaccine available for you. So how are you going to be able to have that second line of defense over you? How am I going to take care of a child that has COVID? What do I do as a parent? I mean, to not know how to treat your child, to just be feeling helpless. So I want to look at the idea of children in Belize specifically, and the cases of, how many children of your knowledge do you know have contracted Omicron in that regards when going back to school?
Well, the separation into Omicron and Delta is all semantics.
Okay.
I tell people that depending on which variant it is, and in this variant that is certainly coursing its way through Belize is more likely Omicron. The Ministry of Health, last I heard, is that they had not identified the strain positively, but where peaks are going, or the peak is going right now, it more likely is Omicron. Now, regardless of which one it is, I kind of separated when the producer asked me how it would affect kids. And I separated into different categories.
Okay.
And all the categories kind of intertwined with each other. So if you want to delve into it, the first one would be physically.
Okay.
That is the question that you asked. So physically, it affects, when you get the COVID, you can be acutely ill. In Belize, before I left KHMH and became ill in October, we had started to see more cases. We had, by that time, had one child who passed away, but that kid had some prior illness before contracting COVID. But now, speaking to my colleagues who work there, they're seeing more and more cases of children coming in. Usually, though, they come with fever, cough. Those are the two commonest symptoms. And then sore throat, and if they start to have issues with breathing, which is a lower respiratory tract infection or pneumonia, they're admitted to the COVID unit, or the unit where they investigate until they get a positive sample. It's called a persons under investigation, or PUI unit. And after 2 to 3 days of antibiotics, oxygen, and care at the KHMH, they're sent home. So most of the kids, and this is the take-home message I give to to all the parents who, my phone is bombarded with parents who ask, that it is usually a mild illness. Even the ones who reach the hospital, maybe 5 to 10% of the kids who get affected with COVID, most of them go home. There is less than 1% who pass away. And if you look on the statistics in Belize, it does confirm to that fact.
Yeah.
So to allay their anxiety a little bit, it is usually a mild, very mild illness in children. So even if they do get whichever variant is circulating right now is Omicron, it usually is a mild illness and they can recover.
Dr. Eck, what makes children less susceptible to COVID in comparison to adults?
That is a beautiful question, and it is one that most of us can't answer yet.
Okay.
The scientists think that because kids right now are getting ill most of the time, and that's to go on an offshoot with the utilization of the hand washing, social distancing, and the masks. In Belize and around the world, we're seeing less of the flu
Definitely.
infection. We're seeing less of pneumonias. We're seeing less of gastroenteritis, acute vomiting and diarrhea. And that is because of those simple measures. So we do know that for us to become immunocompetent, like me and you, we can fight off most of the bugs that we get. The kids are going through that phase, and because their immune system is active against not only other respiratory illnesses, but other COVID infections, they can fight it off easier.
Okay.
The second thing that comes to mind with it is that kids who get the infection, they don't mount a serious immune response to it. And it's the immune response that usually causes a lot of effects, bad effects on adults. So when adults get it, they get it more often. And two, when they get it, it's a more serious illness than children.
All right. And I guess also
that's what the researchers think. That's what the researchers think, but it's not proven.
All right. Thank you for that. So I guess what works with that is that children are better with behavior change because they grow up into the hand washing and all these hygienic practices. While with adults, we have our old bad habits that it's really
that die very hard.
It really takes some time for us to adapt to changes. So maybe that can also be a good factor. So parents have a good ear for that. Educate your children and do what is a proper hygiene. So it really helps in every prevention of many diseases. So thanks for that, Doc.
So continuing with the physical issues that babies would have or kids would have is that they would get acutely ill. The second thing is that some of the kids who get it 2 or 3 weeks, maybe a month down the road, they can get a complication of COVID I call it a chronic illness, which is multisystem immune syndrome. And if you read about it, a lot of people are talking about MISC. That's a short for it. Mm-hmm. But this does happen in other viral illnesses. The pretty term for it was described by a doc in Japan named Kawasaki. So if you look up Kawasaki syndrome, the same syndrome that happens about 3 weeks or a month after getting a viral illness. The other way it affects kids physically is that they don't get, because they're locked up at home, they get limited physical activity. At this time, you will notice that the volleyball gyms would be open, you'd get a lot of football and track and field in Belize. And all of that has come to a virtual standstill. So most of our kids now are glued to their screens. They sit at home because we are, I'll say, guilty of locking them up at home. We buy the expensive snacks, so they sit at home, play the video game, and get fat. And that in and of itself is a risk factor for them down the road.
Yeah, because I'm thinking it can lead into early obesity or onset of diabetes to those inactivities, which on
especially if it's in the family.
Mm-hmm, which on itself are immunocompromising situations. Well, so parents, I hope you're paying attention. Keep your kids active.
I think some parents they don't want to run behind their children because they're already tired from work and everything. But just sometimes that idea of just going out, allowing them to play, having that exposure to the fresh air, not being cooped up, because people keep forgetting you can't just put your child on a phone or a tablet or whatever and just have your lead time because we need to make him move
Right.
around.
So,
Yep.
Doctor,
The,
so, go ahead.
Uh-huh. The second category, I'm going through my little categories would be
I realize
medically.
that. Uh-huh.
Yeah, I'm trying to kind of simplify it so that people get a gist, and then at the end I will kind of link all of them together.
Okay.
Medically, we know that they can get ill with this thing,
Yeah.
and the other thing that comes along with that is loss of their family members. I look at it and say that kids would get sick, and then it's a mild illness most of the time, but they go home too, and in the afternoon. So we're not like the first world countries where people would send their kids to daycare and they have specified places where they go after school care. In Belize, after school care is with granny, grandpa, the older aunt, somebody who lives close to the school. And if they pick up this, whichever variant is circulating, and take it home to those people, those are the guys who get it and won't survive or get severe complications of it. So the medical part comes along with it. I do know as well, another point is speaking with the people from public health. There has been a decrease in child care. The people would go in and take their kids to be seen at the doc and to get their vaccinations. The regular vaccinations like DPT, polio, the BCG, the MMR, all of those, the rates of those being given have fallen because people are fearful of going to the health centers, to the polyclinics. And that in and of itself puts our population at risk of getting one of these illnesses that we have eradicated mostly from our country over the last 10, 15 years.
Wow. So we can definitely see how fear is affecting the health system and the development of children. You said something about family loss and loss at home. So in regard to that, what would you say are some of the psychological or emotional effects of COVID on children?
Well, that's maybe way at the end. So I'll continue, and then at the end we'll get into that.
Okay.
The third one would be educational. And when you speak to the educators in my country, they're, I won't say rushing, but they're trying to get the kids back into school because when they look at the long-term effects of kids not getting into school and learning, we know that me and you and the kids learn from audio, from what they hear, from visual, what they see, and from interacting with each other at school. Without these, the kids fall behind. The parents do the homework and the homework that they send at home for them to do, and they hand it in, and all the kids get A's. But when they go back to school, there's a huge gap that needs to be bridged for the kids to catch up and to continue on in their education. And we do know that when they go back, the in-class learning, where you actually have face-to-face, they have to do their own work, they have to do their own tests and quizzes, there will be a huge gap. And that affects a child and their self-esteem down the road. The next category would be social. I have a kid, and my kid stays in her room. I hear her screaming at her laptop. She has friends that I would say, Rian, what's up with you? And she's just screaming down the place. And when you go in, it's a game that you're playing.
Right, I've seen
that is how they interact.
Yes.
Yeah.
And then to put it in light, one day she actually met one of her friends. And it's a friend from San Pedro, a boy, and they were so shy with each other. These are the same kids that shout at each other over the phone. But when they would be in the same room, they can't even make eye contact. And they would text each other in the same room because that's the way they're used to communicating.
Wow.
So I tell parents, that's my view with my kid. But this is happening now worldwide because the kids don't get that opportunity to socially interact. And it leads to a decrease in their social skills. Most of them become screen-oriented. That leads to the obesity part as well. I don't know if you guys have seen any social interaction or lack thereof in your kids or in other kids that you know.
Right. I mean, it's similar to what you've described. People, like young children, are glued to their tablet or their device.
There's a social
There's
awkward.
minimal interaction,
that
and of
comes.
course, which leads to social awkwardness.
Guys,
I
it's
would
just
say.
social awkward because
Yeah.
you're used to being in front of a screen. So when you're in person, you're just like, how do I people? How do I
Yeah.
operate with these people? Because I'm used to just thinking first. I have my tablet or whatever it is to write out my answers. So it's kind of hard now for me to be able to give out responses like in person. You're watching me watch you. So like, what do I do? Like,
Right.
how do I move? But Dr. Eck,
Hold on, we can link that because it's a very good point with I'll say the first world countries like Japan, like Taiwan, where because of that social awkwardness, the kids don't marry and they don't have children of their own. And if you look on their population pyramid, there is it's an upside down pyramid
Right.
like this.
yeah.
Ours is like this, where you have a few old people and a lot of young kids, but
Right.
theirs are
Seven
upside
other
down.
young people.
And because they don't have kids or the middle of the population having children, there is a real issue with the workforce and with social security payments and with everything
Yeah.
that you can think about. What you guys pay our government for, they don't have that work population anymore. So it does have far-reaching efforts, and
Right.
if a generation would pass, we end up in trouble.
Yeah, so Dr. Eck, you've really shared with us quite some valuable information in regards to how COVID impacts the children presently. We're saying that they're able to recover easier, but at the same time, they can be the ones that can carry the virus
Home to their loved
to their
ones.
loved ones.
Yeah.
And you also mentioned, the implications they can have in the future if we limit kids' interaction, if COVID continues happening and we continue managing it the way we are. So thank you for that information. Unfortunately, we've run out of time on this segment. Is there any last words that you have for our viewers
Well,
in regards to childcare?
To link it all up together, I'll take the last minute and say that with the decreased learning at school and the obesity and the poor social skills or awkwardness, we lead to what I was seeing in my office before I became ill. A lot of kids coming in with low self-esteem, a lot of kids with sleep and eating disorders, a lot of kids with anxiety and panic attacks, a lot of kids with guilt because of their loved ones that died. And that speaks to what you were asking or trying to get into that psychosocial aspect, the psyche of the kids. It does affect a lot of kids. We're seeing a lot more of that right now. The advice I would give parents is try and get them back to school, but in a very safe manner. Talk to them a lot. If they need the professional help, we have professionals out there that can speak to them to get rid of the guilt and the low self-esteem. And that would go a long way with their development.
Yeah,
Most
and to add to that, socialize with your children at home. Do not just leave them with a tablet. Engage with them, read with them, dance with them, play with them.
Trust me, kids have a lot
Yeah.
to say. They love talking, they love playing,
Yeah.
and no matter what, they all want to play. No matter what time, they all want to play.
Fully
So,
agree with you.
so the energy that they have, just try to match it to a level and say, we're going to have 1 hour of playtime, but let's do this and let's have fun with it and give that child that opportunity to interact with a person, because it trickles down into how they deal with socialization moving
Yes,
forward.
yes.
But again, thank you so much, Dr. Eck, for being here. The next time we get you on, we're going to be talking to you about that infamous name, Dr. Shrek. So we're not gonna go into
No problem
anything.
at all.
I'm loving that conversation for next time around, because reliable sources told me about that too as well.
Yes.
But
Yeah. Well, you can't run from your notoriety, so we'll see.
you cannot run. And so with that, we must run to a commercial break, however. And when we're back, we're going to be talking about the Turnif Atoll Sustainability Association and what that organization brings to the table. So stay tuned for that conversation. We'll be right back.